Okay, so Minister, before I ask my questions, I do want to acknowledge the passing of a care worker in a nursing home in Swords. She died of COVID. I've been in touch with some of the families in the care home. They're devastated, as are the residents, as indeed are the people that she worked with, and I don't want to come in here and not acknowledge that, because it's a big blow to the community. Minister, the nursing home sector is reporting a severe difficulty recruiting and retaining staff. In a survey of 252 nursing homes, we've been advised that there are over 1,000 vacancies. 330 of these are nurses, 427 are healthcare assistants. Further pressure on recruitment has been caused by the failure to address the childcare needs of healthcare workers. As you will, and I'm sure, be aware, Minister, the proposals that you made, they weren't just offensive to lone parents, they were functionally useless to the vast majority of people, as illustrated by the response of the unions. If you don't happen to have a spouse working in the public service who's not on the front line, well then there's literally nothing for you. You say that the CEO met on the 19th of February with Nursing Homes Ireland. Would he not have noticed at that stage that there was going to be a problem? I mean, the failure to prepare happened. They weren't ready. They clearly weren't ready. So, I mean, it's a bit mysterious now that the CEO didn't realise that. There's an urgent need to address these staffing issues and to assist the sector to respond. To that end, Minister, I'm asking if consideration has been given to utilising the capacity in private hospitals to assist the nursing home sector. Securing capacity from the private sector was the right thing to do, and I absolutely acknowledge that, but there was no need for it to be a bonanza for them either. The announcement on the 24th of March was made, but there was no deal done for some weeks from what we can gather. That time could and should have been used to negotiate a deal that was good value for money. This open-ended arrangement is far from that. The taxpayer is on the hook for a minimum of €345 million. Has consideration been given to either using the capacity that exists within the private hospital sector, or indeed redeploying some of the workers who are telling me that the hospitals have up to 80% vacancies and that they're so quiet, some of them may be forced to take their annual leave. Finally, Minister, it was you that raised the issue of the potential relaxation of restrictions in your interviews with the media at the weekend, and immediately following those, I had contact from parents and from people anticipating the relaxation. So Taoiseach said this morning that we can't be complacent. He's bang on, but we can't be encouraging people to be complacent either. You need to stop with the mixed messages. You need to be consistent and not fly kites, Minister, because all that does, it raises expectations. You raised those expectations, and immediately as a response, people are contacting their local representatives, they're talking among themselves, and they're asking questions about when and how is it going to be. Is it going to be the 6th of May? When is it going to be? They're not questions that I don't think were in people's minds until they were put there. Minister, can I ask, will the deficit in nursing homes be addressed? Will the private hospital capacity be used? Will you provide details of where the nursing homes and home carers can get a steady supply of masks, not medical masks, as we know, but the non-medical masks as now recommended? Can you point them in the direction? So it's not just nursing homes, it's home helps as well. They're going to need access to this, and they want to know, because they are rightly contacting us. And if you are giving consideration to the use of masks in the community as a mechanism by which, as one element of indeed any relaxation that will happen, can you give us details of the supply chain for those masks? How are they going to be? Because we know in other states and other countries they're handing them out on public transport, they're handing them out in public areas. Is that where we're going? And if we are going to go there, are we ready to go there?
Minister, I want to ask you about the waiting lists currently for home care packages. We know the importance of keeping older people and those with underlying health conditions safe in their homes, and where that is possible, we really need to ensure that they receive an appropriate level of care at home to meet their needs. Nobody should be left waiting for home care when they have deemed to need it at any time, but especially at this time. The latest figures for my own constituency are from last month, and they relate to the waiting list as of the end of February. 141 people waiting for new home care packages in County Galway and 69 people waiting in County Roscommon, with 27 people across both counties waiting for additional home care supports. I would like to know if these waiting lists have been cleared, and if they haven't, if you can provide me with the up-to-date figures as per the number of people waiting for home care per county in the state. These are the very people who need this care provided to them now. They're the very people that we need to keep at home to keep them safe during this pandemic. And I'm asking you to put the necessary funding in place to ensure that these waiting lists are cleared and that those who require care at home receive it. Gurmagh.
Deputy O'Reilly and Deputy Curran, I want to join with the Deputy in offering my sympathy and condolences to that family and indeed all families bereaved at this moment. We think of them all. In relation to the issue of staffing in nursing homes, I think the Deputy makes obviously a very valid point. We know that nursing homes are often challenged in relation to staffing, and we know that there's often significant, quite frankly, competition between elements of the health services, be they public or private, to obtain staff. I genuinely believe one of the best things we can do to help nursing homes after engaging with them in terms of staffing is to ensure that we quickly turn around the test results for staff in nursing homes. I saw a figure last week, I don't want to quote it on the record of the Dáil in case I get it wrong, but I saw a figure last week in relation to the number of staff who were out awaiting a test, a very high figure, considering we know most of them are going to be negative and could then return to work. I think the decision to prioritise that testing will result in many more people getting a negative result, hopefully, and being able to go back to work. The HSE has so far said that I think there's been 61 people directly redeployed by the HSE into the private nursing home sector. They're doing it's a small number, but it's a voluntary agreement. They're doing a census tonight. They expect that figure to be up, but that is the current position. In relation to childcare, I don't want anyone to think anything is offensive or discriminatory. What we're trying to do here, and I admit finding it more challenging than we thought, is trying to find a way forward that respects the public health advice. What we want to do is twofold. We want to allow public officials, public service employees, stay at home if their other half, if you like, is a frontline healthcare worker and have paid leave in that regard. But secondly, then we want to look at the possibility of allowing a registered childminder into your home, but we can only do that when NEFA tells us it is safe to do it. So that's something that will be looked at in the context of the roadmap. I've already engaged with the INMO yesterday, and I'll be engaging with them again tomorrow more formally in relation to this. Just the point you made about when the HSE CEO met the nursing homes, did he not realise there was a problem? Realising there's a problem and a challenge is different to being able to keep a virus out of nursing homes. We're seeing this the world over. And there is perhaps some attempt to suggest that this is an Irish-specific problem. Of course it isn't. The rates, sadly, of infection and mortality here in this country are similar to many other countries. But of course we know many other countries, including some very nearby, aren't even recording in the way that we're recording. We're actually now going into nursing homes and trying to identify the virus, trying to identify it and not masking it, and only announcing deaths in hospitals and not in nursing homes. Dr. Siobhan Kennelly, who is the clinical lead for older person services and obviously a doctor, she did make the point, and it is a point lost in the debate, there are more people, thank God, recovering from COVID-19 in nursing homes than sadly passing away. And I say that because I'm conscious there's a lot of people possibly watching in here worried about their mum or their dad or their loved one in a nursing home. The majority of people are actually recovering from COVID-19. In relation to private hospitals, you make some sensible suggestions, as I often believe you do. I reject the phrase bonanza, as I've said to you before, but I know these are phrases you feel you have to say. But in relation to your assertion about a bonanza, let me be clear: nobody will make 1 cent or €1 in relation to this, to the private hospital deal. I published it as you requested fully, and all that will be paid is the cost of running those facilities. I want to make them busier. We've seen more than 3,500 patients currently through them. We've seen 127 consultants sign up. We need to see more. And all costs that we pay over can be scrutinised by the Controller and Auditor General. The point you make about capacity, though, and spare capacity there in the context of the nursing home is a very valid point. It's something we're actively looking at now. Look, on the relaxation question, when I ask questions, I try to answer them. Sometimes I give the right answer, sometimes I give the wrong answer. But in relation to the questions, I mean, I was asked, as a minister and as a citizen, what would I like to see coming back at a safe point in time? And I thought an awful lot of the commentary has been around the economy and around the wishes of certain interest groups in the economy, important issues. And I get an awful lot of letters and correspondence from kids telling me they were missing school and their friends and their own mental health and well-being. And I made the point that I'd like to see a way of schools being able to come back at the appropriate time. I was asked, is there a timeline for that? I said no. And I asked, when would that be? And I said, when the National Public Health Emergency Team believes it is appropriate. What we need to do over the next week now is, though, publish this roadmap so people can see what the different phases look like, because I'm conscious of not wanting to give out mixed messages. The next 12 days really do matter. On the issue of masks, the National Public Health Emergency Team will consider the more broad issues, and I'll come back to you specifically in relation to the supplies for the nursing homes that you referenced. And sorry, Deputy, I'm going to run out of time, but on the issue of home care, I have a note here just in relation to the fact that we've been looking at both priority 1 and 2 clients in terms of how we could perhaps in some cases reallocate resources from some lower priority cases to help those more in need at the time of COVID-19. We've only done that, though, where there are other supports in place. All cases are reviewed by a public health nurse. So if you have any specific cases, I'd be very happy to discuss them with you. We're also obviously asking that the HSE very closely map the impact of this pandemic on the provision of the home care targets set out in the National Service Plan.